Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 155. A 32-year-old man complains of pain in his legs that intensifies during walking, intermittent claudication, numbness of his toes, extremity coldness, and inability to walk more than 100 meters. When he sleeps, his leg usually hangs down. The patient has been smoking since he was 16. He drinks alcohol in excess. The left leg is colder than the right one. The skin of the extremities is dry. No pulse can be detected on the pedal arteries, while pulsation of the femoral arteries is retained. What is the most likely diagnosis? A. Obliterating endarteritis. B. Leriche syndrome, aortoiliac occlusive disease. C. Raynaud disease. D. Deep thrombophlebitis. E. Diabetic angiopathy. Obliterating endarteritis is severe proliferating endarteritis, inflammation of the intima or inner lining of an artery, that results in an occlusion of the lumen of the artery. The lower extremities are often affected. Causes: complication of radiation poisoning, tuberculosis, meningitis, syphilis infection, chronic poisoning by substances, e.g. nicotine, lead, causing spasm, frequent exposure to cold, low temperature, frostbite, trauma, vibration, chronic neuritis, arthroarthritis, spine osteochondrosis, mental stresses. Raynaud's disease is usually triggered by cold temperatures, anxiety, or stress. The condition occurs because the blood vessels go into a temporary spasm, which blocks the flow of blood. This causes the affected areas, usually fingers and toes, to change color to white, then blue and then red, as the blood flow returns, usually with warm temperatures. Leriche syndrome is a progressive disease that presents as a triad of claudication, erectile dysfunction, and decreased distal pulses. Risk factors are hypertension, diabetes mellitus, hyperlipidemia, and smoking. Some patients are asymptomatic because of sufficient collateral blood flow. Claudication is pain in the legs or arms that occurs while walking or using the arms, caused by too little blood flow to the legs or arms. It is usually a symptom of peripheral artery disease, in which the arteries that supply blood to the arms or legs, more common, are narrowed. The answer is A. Obliterating endarteritis.